I'm Jim Briggs, occupational therapist and consultant for Delta Airlines regarding physical abilities testing. This segment is about the ramp test. So the first test is going to be the standard kneeling lift test from the floor with the bag lying flat. Raise the bag up, pivot 90 degrees, place it at 30 inches and return it to the floor. If this is done successfully, you're going to ask the question, is this the heaviest amount of weight you can lift safely for this task? If they give you an affirmative response that they can do more, then you're going to allow them to put 1 to 2 weights in the bag and repeat the lift. The MAW for this lift is 55 pounds. The weights that you should have available should range between 2.5, 5, and 10 pounds. We allow them to have smaller weights so they can get to their maximum ability. And with the maximum available weight being at 55 pounds, and using these denominations, you can pre-weight the bag to 20 pounds if you prefer. That's not a requirement, but in hiring events, it's certainly encouraged that their first lift be at 20 pounds. Then they have a remaining 35 pounds available, and if you use the 2.5, 5, and 10 pound weights to achieve that additional 30 pounds, you should have about 3 additional lifts past the initial lift, and that's what we're searching for. So we're going to be looking from time to time at the tests that are being done, and we'd like to see 3 lifts other than the initial lift. You get into too many more lifts than that, and fatigue starts to set in, or less than that, the increment changes are too great. So that's our ideal that we would like to have, is the initial lift plus 3 more. The kneeling bag lift's the first lift, and then we're going to go into a new lift. It is a repetitive lift that's done while they're on their knees. You do start with a pre-weighted bag at 36 pounds. Now, how do we get there? So in the initial kneeling test, the standard kneeling test, if they can get 36 pounds or higher in their weight, they're allowed to take the repetitive test, which is also a kneeling test. And it's a circuit type lift. So you're going to have several lifts at 180 degrees of each other from floor to floor. Then it's going to go from floor to shelf at 24, be 2 lifts there. Then it's going to be from floor to table, 1 lift. So it's a 3-2-1 sequence. And those lifts are all pre-weighted at 36 pounds. They don't start with an empty bag, don't start with a bag at 20, but you start at 36 pounds. After they complete that lift, you would set the bag on the 12-inch platform, and they would perform a lift from 12 inches to 60 inches. Once that's completed, they will go back to a 55-pound MAW for a 12 to 24-inch lift. And that will complete the ramp test.
When you're setting up your weights to do the test, per AEI protocol, the bag cannot weigh more than 20 pounds. So you can pre-weight the bag up to 20 pounds, but not over 20 pounds. So that's what we have set up here. The weights inside of this bag that are marked with blue, that makes that bag less than 20, right at 20 pounds, okay? So for our add-in weights here on the side, you're adding weights up to 55 pounds is our total. So ideally, your add-in weights should be 2 10-pound weights, 2 5-pound weights, and 2 2.5-pound weights to make your 55-pound bag. You want to make sure that after their initial lift with the weighted bag, that they have 3 more lifts afterwards. So you can see when we set up, the applicant can add up to 2 weights when they lift. So here they would have 3 additional lifts after the first lift. Now we also have a 1-pound weight that will be needed for the circuit to add in, because it is 36 pounds that the bag should weigh for the circuit.
Lift test instructions and agreement of understanding. These tests are an evaluation of your maximum lifting ability. There is a lifting requirement that you need to meet in order to qualify for the job. In order to be successful, it is important that you continue each test until you reach your maximum safe lifting ability. I will stop each portion of the test once you have reached the maximum required for the test, or if I notice any indications that you have reached or exceeded your maximum safe limit, such as unsafe lifting postures or movements. You can stop each test at any point you feel you cannot lift more safely, but understand that if you do so, you may not pass. For the ramp test, you will perform the following lifts. Kneeling lift. While kneeling on one or both knees, lift a bag from the horizontal flat position on the floor with only one hand on the handle and the other hand anywhere else on the bag as desired using any method of grasp. Turn 90 degrees, place it on the 30-inch surface, and return it to the starting position. Based on your performance, you may be allowed to add weight and perform more lifts. Kneeling circuit lift. While kneeling on one or both knees, lift a bag with only one hand on the handle and the other hand anywhere else on the bag as desired with any method of grasp, and place on designated surfaces. Lift the bag from the horizontal flat position on the floor, turn 180 degrees, place it vertical on the floor, lift and turn 180 degrees again, returning it to the starting position. Repeat 3 times. Next, lift the bag from the floor, turn 90 degrees, placing the bag on a designated 24-inch surface before returning to the starting position. Repeat 2 times. Then, lift the bag, turn 90 degrees, and place it on a designated 30-inch surface 1 time before returning it to the original starting position. This is 1 circuit. You will be asked to complete 9 consecutive circuits. 12 to 60-inch bag lift. While squatting or kneeling on one knee, lift the bag from the horizontal flat position at 12 inches with only one hand on the handle and the other hand anywhere else on the bag as desired with any method of grasp. Turn 180 degrees and place it on the designated 60-inch shelf before returning it to the starting position. 12 to 24-inch bag lift. Lift a bag from the horizontal flat position at 12 inches, holding it by the handle with only one hand and the other hand anywhere else on the bag as desired using any method of grasp, and place it on the designated 24-inch surface. Then return it to the starting position. Based on your performance, you may be allowed to add more weight and perform more lifts. After each lift, ask yourself if you feel you can lift more weight safely without experiencing pain and or extreme discomfort. Do not attempt to handle more weight than you feel you are capable of handling. When you have reached the maximum weight you can lift, you may sit down and rest. Please do not hesitate to make weight adjustments by adding or removing weights in order to better judge the maximum weight you can lift. During this test, your safety is our primary concern. Please take your time in between lifts so that you do not become fatigued. I will demonstrate each of these lifts for you. Do you have any questions?
Be sure the form is signed prior to beginning the first lift. It's very easy to get distracted at the end of the test and the applicant will leave the room before signing. So now is the best time to sign. And then the test administrator or proctor should sign as a witness.
Changes in test administration. It is important to note we will no longer use the wrist or chest-mounted heart monitors or pulse oximeter, regardless of brand, to perform any Delta test. Instead, we will use a 10-second manual pulse taken at the wrist or elbow. To assist in the calculations of the 10-second heart rate, please see the conversion chart.
So let's have a quick review and run through the testing. We're going to start with the kneeling bag lift. You're now ready to begin your demonstration. So set the bag up on the floor, laying flat or horizontal, and you're going to have the bag pre-weighted to 20 pounds. So this is just going to be the initial lift from floor to 30 inches, and you can pre-weight to 20 pounds, but no more than 20 pounds, otherwise you're not within the AEI protocol. Your MAW is going to be 55, so after the bag's pre-weighted to 20, you should have 35 pounds of available weight for the applicant to lift. Give the participants some knee protectors, and you should have some for yourself too. The knee protectors are going to be necessary. So if we don't have any, we cannot continue with the test because they're absolutely necessary for the repetitive lift test. Okay, so now that you've got your knee protectors on, knee pads, you're ready to start demonstrating. And this demonstration should be done on both knees first and then one knee, or vice versa. But you need to demonstrate both methods. Both methods require a pivot and not a twist.
I'm going to demonstrate the next lift for you. You can do it either on one or both knees. I'll demonstrate both for you.
The test administrator should thoroughly and carefully explain the testing procedure while using proper body mechanics and lifting techniques during the demonstration. If you demonstrate the lift test incorrectly, most likely the applicant will perform the test incorrectly, and we do not want this to happen. So make sure that you understand how to demonstrate the test and that you can give an accurate demonstration. Again, you should have your knee pads on, and they should also have their knee pads on.
The only restrictions are: all bag lifts start with the bag in the flat horizontal position. One hand has to remain on the handle, while the other hand can be placed as desired, including on the wheels. The participant must remain kneeling. The bag must be rotated a total of 90 degrees from the point of lift to the point of placement. It is okay if the participant pivots on his or her knees during the lift, but do not twist the back and abdomen.
So they should perform the lifts in a slow, sustained manner. The applicant should understand that they have the opportunity to stop the test at any time should they experience any pain or discomfort. So the test administrator is also responsible here, and you need to watch carefully for any signs of undue stress or fatigue, such as a rapid change in lifting posture, muscle tremors, or any sign of weakness. And it might be something that they verbalize, or it could be just facial expressions. But you need to pay attention to that. And if they are demonstrating any of those, it could be that they have exceeded their maximum effort, and we need to stop the test at that time. This is where clinical judgment comes in. So for the kneeling test, we have a little review. The first lift can be done with no more than 20 pounds. It can be up to 20, but no more than 20 pounds. After they successfully lift from the floor to the table and back to the floor, you're going to ask the questions. Is this the heaviest weight you can lift safely for this task? Once you have an affirmative answer, they can continue. You would allow them to put 1 to 2 weights in the bag and repeat the lift until they reach their MAW or they're not able to lift any more weight. Again, the MAW for this lift is 55 pounds. No single weight should be over 10 pounds. Should be denominations of 2.5, 5 pounds, and 10 pounds that are available for the applicant to lift. And once they have reached the MAW of 55 pounds, the test will be over.
The test administrator is responsible for keeping the participant from performing repeated lifts too quickly, such that fatigue may become a factor. After the applicant completes the kneeling bag lift, document the maximum weight successfully lifted.
Now it's time for the kneeling circuit lift. If the applicant was able to lift 36 pounds or more during the standard kneeling to 30-inch lift, where they went from the floor to the table and back to the floor. So this lift's going to be a little bit different. You're going to demonstrate this lift with a totally empty bag. Also, they're going to be allowed to demonstrate the first circuit of the repetitive lift with an empty bag. And it's not timed, doesn't go toward their 9 circuits. So this is just merely a demonstration to make sure that they understand the proper method and sequence of performing the lifts. So once you have established that they understand the lifts and they're ready to move forward, then you pre-weight the bag with 36 pounds. This is according to AEI protocol. You do not start with 20 pounds. You go all the way to 36. They've already lifted 36 on the kneeling test or more. You wouldn't be doing the repetitive lift test. So let's make sure that we've got the weights right. And so you need to understand when you set this up how many weights it takes to get you your 36 pounds. So once you have your 36 pounds in the bag, they will perform their first lift of the circuit.
You'll start in this position. You have to pick the bag up to a vertical position, turn 180 degrees, set it on its side. And then to a flat position, remove your hands from the bag each time. You do that 3 times. And then you go from here to this shelf. You do this twice. Slide it so that you have a 90-degree lift up to the table, just like what we just did. Do one of those, and that is one complete circuit.
Once they've completed their repetitive lift test, then you're ready to go to the 12 to 60 inch test.
The 6 instructions given during the 12 to 60 inch bag lift demonstration. 1. Use preferred posture, wide stance squat or kneeling on one knee at the start of the lift. 2. Rise with head and shoulders first. 3. Have at least one hand on the handle of the bag. 4. Pivot 180 degrees and do not twist the body. 5. No leaning backwards. 6. Do not stand on tiptoes. The fourth and final task is the 12 to 24 inch bag lift up to 55 pounds. The 4 instructions given during the 12 to 24 inch bag lift demonstration. 1. Use preferred posture, wide stance squat or kneeling on one knee at the start of the lift. 2. Rise with head and shoulders first. 3. Have at least one hand on the handle of the bag. 4. Pivot 180 degrees and do not twist the body.
You can live here.
When you have finished the test, double-check to make sure all the necessary data fields are complete. All signatures are on the medical questionnaire and test instruction forms.
Effective as of March 11th of 2024, the following revisions to the RAMP protocol have been implemented. The repetitive lift test. There will now be only 2 manual pulse heart rate checks during the repetitive lift test. These will be performed at the completion of the 3rd and 6th circuits. The completion time for the repetitive lift test will now be 15 minutes and 30 seconds as the passing requirement. The 12-inch to 60-inch bag lift. Since this lift follows the repetitive lift test, the lift can begin with bag and weights weighing a total of 36 pounds, or the 1 pound weight can be removed so that the starting weight is 35 pounds. The safe maximum for this lift will now be 55 pounds, maximum weight of the bag and weights combined. Following the completion of this lift, the ending weight can be used as a starting weight for the 12 to 24 inch lift. Medical crisis documentation. This document has been updated to include options for low blood pressure and high resting heart rate. When completed, this document will be retained by the event lead proctor. PAT interruption documentation. This new document has been added to the CMP. The purpose of this document is to establish written documentation of any pause in testing for consultation with the lead proctor and/or medic. When completed, this document will be retained by the lead proctor. Please see the Delta Airlines CMP dated March 15, 2024 on-site only for full details.